Is Dr. Alicia Arbaje. I am a geriatric medicine physician, and I'm so pleased to be here today to talk about issues around the COVID-19 vaccine. I know that some people, and myself included, were initially hesitant about the vaccine and whether to take it or what's the right decision to protect yourself and your family. So the AGS Health and Aging Foundation sat down with health experts in order to help describe some of the challenges and the disparities that are there for those of us in communities of color to help us feel more confident in making a decision around the vaccine. We will be hearing from Dr. Sharon Brangman from SUNY Upstate Medical University in Syracuse, New York, and Dr. Jerry Johnson from the Perelman School of Medicine at the University of Pennsylvania. Doctors Brangman and Johnson will talk about the use of the vaccine in communities of color and their own personal experiences. We hope you find this helpful as you make your own decisions.
Why do we need a COVID-19 vaccine?
The COVID-19 vaccine is of critical importance to try to control this disease, which is one of the most frightening infectious diseases that I've encountered in my over 50 years of practicing medicine. The vaccine has caused tremendous sickness, and it's not just the physical effects of the infection itself that have been so damaging, but also the social effects: despair, isolation, loneliness, persons being in the hospital, not being able to receive visitors, persons dying. The vaccines are safe, they're effective, and they can prevent hospitalization and death, and even prevent persons from acquiring mild disease. So we need this vaccine, and I am extremely excited that it's available and that I was able to take it.
This country has a long history of bias and health disparities. Why should we now trust the COVID-19 vaccine or the government's efforts to get people vaccinated?
Well, this country has had a long history of supporting bad healthcare and bad research on people of color. That's a very bad legacy, but I think with this vaccine, that legacy is behind us. That's not to say that our healthcare system does not have problems with racism or disparities in healthcare, but we know that COVID has had a very bad impact on people who are Black and brown, with higher death rates and higher rates of being left with serious illness. So this vaccine is a way of helping to reduce that risk and helping people live a full life and protecting their families.
So I think the way that many of us in the Black and brown communities think about the vaccine, once we have had a chance to learn how important it is and that it's safe and effective, that's really the question that should be asked by anyone who's concerned about whether or not they should take the vaccine. But once we know that, then it's time to move beyond the past where there were concerns about research that was harmful to Black and brown persons. That's really the way we should think about it. That history has to be put in the context of now we have an opportunity as individuals and communities to do the opposite. That is to get the best treatment, to get equal treatment.
Are the vaccines effective?
Clinical studies that these vaccines that we're using in the United States were 100% effective at preventing hospitalizations and death. I mean, that is remarkable. 100% effective in preventing hospitalizations and death, and 95% effective overall in preventing persons from developing any symptoms, even mild disease. So
the vaccines have been shown to be very effective. They are 100% effective in keeping you from getting serious life-threatening COVID. That's the type that would put you in the intensive care unit or on a respirator. So the vaccines are safe and they work.
And are there side effects to the vaccine?
They're mild. They're sort of like the side effects that one has after taking would expect to have after taking a flu shot, which many of us have been taking for years and years and years. So That's really the way that I would think about them.
Have you received the COVID vaccine yourself? And if so, why did you make that choice to get it?
It's not just the risk for us as individuals, but it's the risk for persons that we love. It's the risk for friends. It's the risk for family. It's the risk for coworkers. If we work in whatever profession we work in, it's a risk for them. I think about persons who work in nursing facilities, and those staff members, if they bring the vaccine into the facility, then they're putting all those persons at risk. So I had the same mindset. I got vaccinated because of myself and because the person's dear to me.
I've received the COVID vaccine, and I'll be very truthful that in the beginning, I was a little skeptical and hesitant. I was concerned because the vaccine was made very quickly, and it took me some time to read the information about it and find out that even though it was made quickly, it was not rushed. The Pfizer and the Moderna vaccines in particular are made using techniques that have been available for about 20 or even 30 years. So they were ready to go as soon as the virus started to invade all of the countries of the world. So I found out that the vaccine was made quickly, but it wasn't rushed. So that gave me a lot more confidence in taking it. So when I realized that the vaccine was made quickly, but not rushed, and they didn't cut any safety corners, I felt confident in taking the vaccine myself. And I've also recommended it to everyone in my family.
Anything else that older adults and caregivers should know about the COVID vaccine?
The most important thing to know about these vaccines is that they are effective, they work, and they are safe. They are a major part of our defense against this terrible disease that's caused major disruption across the entire world. So this is a major part of the defense. It's not the only defense. We still have to social distance and wear a mask and wash our hands. All those things are going to be important for many, many months to come. But the vaccine is an important part. So please get one. Encourage persons that you know and love to get one. And that will be in your best interest and in theirs also.